Hello, everyone. I'm Tina Cosby with WTLC AM 1310 and 95.1 FM. And we are here today to inspire you with a reminder that the time, once again, for open enrollment for health insurance is not only underway, but it is coming fast, the deadline. The deadline is approaching very, very quickly. That deadline, of course, will be January 15th of 2025. So together with Eskenazi Health and us, WTLC AM 1310 and 95.1 FM, we are wanting to make sure that you have everything you need to know as you make plans for health insurance coverage. And joining us now from Eskenazi Health are none other than our good friends, Victoria Evans, Director of Patient Access Services, and Marcus King, Patient Access Services Operations Manager. Vicki and Marcus, welcome back. We're doing this. Glad to have you both with us again. How are you doing?
We're doing well. Thanks for having us.
Yeah. Thank you. Well, the last time we spoke about this, and again, we're here to inspire everyone, inspire you and everyone else out there in our listening and viewing range. We talked about the fact that the process can be confusing. And I'm assuming that there have been changes that kind of add to that each and every year. Is that correct?
I think insurance is always changing, insurance options. So every open enrollment period, different plans that cover different types of health services for individuals.
Yeah. So where are we right now as we stand as of today? Where are we?
I think we're about I guess you could say almost like midway through open enrollment. In order to secure your coverage by January 1st, you need to enroll and pick a plan by December 15th. You have until January 15th to enroll. That start date would then be February 1st. So we're about halfway through this year's open enrollment period.
So I gave one deadline, I guess, the drop down. But can you explain the three different deadlines that you just went through again a little more in detail? Can you?
Yeah. So open enrollment officially ends on January 15th. I think the one thing to keep in mind is that if you enroll after December 15th, your insurance coverage doesn't start at the first of the year. It's actually February 1st. So for those individuals who are interested in the marketplace and hoping to enroll, it's better to enroll before the December 15th deadline so that they can ensure that they have insurance coverage at the beginning of the year.
Yeah. Now, this is for health insurance again, and totally separate from the Medicare deadline, which recently just passed as of this taping. This is for health insurance, correct?
Correct. Medicare is a form of health insurance. I just think that they target different patient populations.
So who should be listening and being inspired by this right now as we speak? Who are you talking to? Who are you and Marcus talking to?
So when we talk specifically about the marketplace at healthcare.gov, we're reaching out to individuals who may not qualify for a Medicaid program or a program through the state of Indiana Health Coverage Program, somebody who doesn't have insurance offered through their employer. We want them to know that they have additional options through the marketplace. So those are the individuals that we're targeting outside of your Medicare, outside of your Medicaid enrollees, and outside of individuals who have an employer who offers insurance. You can get healthcare through healthcare.gov.
Yeah. And when we talk about the marketplace, again, for those who may not be familiar with the terms and the terminology, exactly what are you saying? You mentioned it and you explained it, but can you go back and go do it again? The marketplace, that means what?
So that is insurance coverage through the Affordable Care Act. So the Affordable Care Act comes up with the marketplace. They have these plans that cover essential health benefits as deemed essential by the government to make sure that the plans that are in this marketplace cover the things that people need. So it's managed by the federal government to make sure that we get the right things that we need. But it's a place to go that if you don't have insurance through your employer or you're not eligible for Medicaid, you can receive some assistance through premium tax credits that would allow you to get that coverage and make it a little bit more affordable for you.
Fundamentally, what do you need to get coverage through the marketplace, the Affordable Care Act?
So all you need is to come in and submit an application. There are different things that they may require to verify information. A lot of times that they have the systems necessary to do that through the way we file taxes and verification of identity and things like that. So there are individuals that may not need anything, but there are individuals that may need to verify their identity with an identification, or they may need to verify their income with a few paycheck stubs.
But I think the first step is to just apply.
Yeah.
And for me, I was going to say, for me, the marketplace is a place where they can shop for insurance. I mean, essentially, that's what you're doing. You're putting in your information to see what types of plans are out there that you qualify for. And then you make the decision in regards to which plan, you think would fit your needs for the upcoming year.
Yeah. And as these individuals are shopping, as our public is shopping for insurance through the marketplace, because I like the way you put that, you're basically shopping for insurance. What types of price ranges or costs for this insurance through the marketplace can people expect? Is there a range that you can kind of let people know about?
Not necessarily, because it really is contingent upon like your household size, your income. And then, like Marcus said, the cost of it can be offset by premium tax credits if you qualify. That's why it's important just to take that first initial step to see what your options are. And then from there, you can kind of pick and choose, what's non-negotiable, what do I definitely need, in regards to this insurance coverage. Does this make sense for me, to be paying this amount of premium every month? For instance, if I'm somebody who has multiple health conditions, and so I'm going to doctor visits pretty regularly, I have, prescriptions that I've got to get filled monthly, it may make, more sense for me to potentially pay a little more at each visit than to have a high deductible that it takes, the majority of the year for me to reach before that insurance, actually kicks in. So those are the types of conversations that we can have with individuals who are interested in the marketplace and don't necessarily qualify for Medicaid or coverage through their employer or Medicare, so that we can really help them determine like what makes the most sense for them. And then are there opportunities to impact what they're required to pay on a monthly basis?
So by and large, how many Hoosiers are able to take advantage of insurance through the marketplace each year? Do you have those numbers? If not, that's fine. But I'm just curious if you have a guess.
We don't have those numbers, readily available at this time. I just think that if you don't have options through your employer, and that you don't qualify for Medicaid, maybe because you've already applied, and you don't meet eligibility for Medicare, then this is something that you may want to consider, because I think in regards to health insurance, it's something that we don't think that we need until we need it. And then when we do need it, it's usually because, unfortunately, we've experienced, a pretty scary health issue or concern.
Yeah. So take us through the steps. Someone is listening and watching right now and says, you know what? I want to test the marketplace. I want to see what I can qualify for. First step is to do what? Go where? Do what? How does one get started?
So the first step is to go to healthcare.gov and register for an account. It's going to prompt you to create a username and password, some security questions, and this is the account that you'll use, or the information that you'll use to log in each year. Once you've done that, associated with an email address for communication, you'll then go ahead and submit an application. You'll go through the application process, and at the end of the application, it'll give you your options. Like Victoria said, it'll allow you to shop some plans, tell you what they cover and things like that. You can apply as much of your premium tax credit to your monthly premium as you like to offset that cost. And then when you're ready and you've decided of what, which plan you want, you would then make a payment through that managed care entity.
And if you don't feel comfortable doing all of that by yourself, because it can seem like a lot, it can feel like a lot, you can come see us.
Yeah, the next question is going to be, how can our friends at Eskenazi help, our partners at Eskenazi Health, how can Eskenazi help with that process?
So all of our financial counselors and patient financial advocates are trained in the marketplace. And we do offer appointments. We have patients and community members who will walk in when it's convenient. You can, if you have a MyChart account, you can schedule an appointment through MyChart. And then we have a financial eligibility services team that you can contact via telephone and get that appointment scheduled.
And again, this is all free of charge. There's no fee or for any of this. This is all a community service, correct?
Correct. And if at that point they decide that, hey, this isn't something that I'm ready to move forward with at this point, like no harm, no foul. We're just here to help and make sure that everybody understands their options when it comes to securing insurance coverage.
Yeah, I think that's another good point. Just because you go through the application process doesn't mean you're locked into making a payment to any sort of insurance provider. You can submit an application just to see what your options are. And if you choose not to take any of those, that's perfectly fine. You're not locked into or obligated to do that.
Well, with the deadlines as they are that you've all outlined, how long should people expect before they hear, if they want to go through with it and say, hey, this is my choice, I've applied whatever, and you say make your first payment by December 15th for something. I think I heard you say that. But, so what's the timing? What's the timeline that people can expect?
Well, an application, it only takes about an hour. By then, at the end of that application, we'll know if it's able to verify your identity through those data sources and things like that. We'll be able to know immediately what plans you qualify for and what your options are. And then a couple of days, everything links up in the system and you can make that first payment. So it's not something that takes, weeks and weeks, but you know your options immediately.
Yeah. So it's not necessarily like you apply and then you have to wait for someone to review your application and then make a final decision in regards to whether or not they're going to grant you this coverage. Like Marcus said, if they're able to verify the information that you input at that point, then you'll see what your options are once you complete that application. And if they're requiring additional information or documentation, you will know at that point as well. And then by creating the account online, you can always go back in and pick up where you left off or submit the documentation electronically to kind of move things along.
Yeah. Every year when we hear about enrollment, regardless, and we hear about online and things of that nature, we always get a little pushback from people who say, but I'm not computer savvy, or I'm not technologically savvy, or I don't have a computer or a laptop, and I don't know how to work this phone to make it. How can Eskenazi help there?
So we have all of those things to help. We've helped individuals get their initial accounts set up. And essentially we go through that entire application process with them. And then if for some reason they are required to submit additional documentation or information, if they get that to us, then we're more than happy and willing to do that as well, to help them secure that coverage.
So if you're technologically or technology challenged, that's not a barrier, because that can be mitigated. That can be taken care of at Eskenazi Health as well.
Correct.
Yeah. So what if your coverage, what about people whose coverages have changed from, 2024, that they'll no longer get the same coverage for 2025? What are they to do?
So if you want the same plan, a lot of times you can just re-enroll, and continue with what you had. But if you didn't like it, if you want something different, it's just as simple as logging into that portal with your username and password that you used last year, updating information, and then it, right then and there, it spits out, the options that you have right now that you have access to change to.
So once you enroll in a plan in the marketplace, are you with that? Those plans are good for what, the next calendar year, or can you change your plan mid-range, or how does that work? Are you locked in at least 12 months at a time? How does that work?
Yeah, so you're in that plan until open enrollment of next year.
Okay, of the next year.
Unless you have a life-changing event that opens up a need for special enrollment. Usually those things are like any addition to your household size. So marriage, the birth of a child, things like that, moving from one state to the other, losing your job, getting an increase in income. Those things will kind of open up a special enrollment period for you. But outside of that, yes, you would need to wait until open enrollment this time next year to kind of change that plan.
Go ahead.
Oh, I was going to say very similar to enrollment period, if you've ever enrolled in benefits through your employer, right?
Yeah.
So you have this specific time frame where you can make any updates or changes. So open enrollment for the marketplace, you can shop around for insurance and pick it for the first time. Or if you've had it, then it's an opportunity to make any changes that you feel that you need to make.
And, Marcus, you brought up something that gave me a question about, like, if you move out of state or what have you. What if you're out of the state of Indiana and have a health situation and you've purchased insurance through the marketplace? How does that work? Are you covered?
Yeah, most plans covered under that essential health benefits that we kind of talked about earlier. One of those is emergency services. The other one is hospital stays. So in order for these plans to be a part of the federally funded marketplace, it has to cover some of those essential health, or all of those essential health benefits, two of those being emergency services and hospitalization.
So if you're visiting and you have a medical emergency and you've enrolled through the marketplace, you're covered.
Yeah.
Okay. That's good to know. That's good to know, because I think some people don't think. So then what is your best advice to anyone who is considering it or thinking about it as of right now, today? What's your best advice and your best guidance to people looking for health coverage right now?
I will go back to what Vicki said. Eskenazi Health is here for you. Any questions you have, if you have one or two questions, or if you need us to walk you through the entire process, we're here for you. I want to give our 1-855 number. It's going to be 1-855-202-1053. 1-855-202-1053. If you call that number, they can get you scheduled to meet with a financial counselor, as Vicki stated earlier, at no cost, at no obligation. So once we walk you through the process, you're not obligated to do anything to enroll in any plan, but we want everybody to know their options during this limited time that we have in order to plan for 2025.
Yeah, and it while it may seem like that's a lot of time, you hear 2025, you hear January, people think, oh, that's in the distance, but those deadlines roll up on us very, very quickly. And
they
so
do. It's also like the holiday season. So I think, a lot of people feel pressured to be able to provide, for their families during this time. And so I think sometimes it could just seem like one additional, thing to think about or have to pay for. But it really is beneficial in the event that, you need healthcare.
Well, yeah, it's an additional task on top of everything else. As we get ready to wrap up the year and head into the new one, it's an additional task, but an important one because you have to make sure that you're covered for your health care. I mean, it just, yeah. So, but that's why we're here. We're here to inspire people to get on it. So sooner, much sooner rather than later, I guess would be the advice from the both of you.
Yes, sooner versus later. And if you're considering it, come see us and we can walk you through the application and all of your options. So at least you have the information to make the best decision for you and your family.
Okay, and the access to you at Eskenazi, Monday through Friday. Are you available on weekends, nights? What is the access, and what should people know about as they begin to approach for help in navigating the marketplace?
Yeah, so all of our financial counselors are trained in marketplace, and we are located throughout Eskenazi Health. So we've got a financial counseling suite at the main hospital. We're located in all of our federally qualified health centers.
Mm-hmm.
And so you can reach us, like Marcus said, by calling the 855 number. Walk-in appointments are welcome as well. Typically, we're open Monday through Friday, 8 a.m. to 5 p.m. We do have some extended weekend hours at select locations. All of that information can be found online at eskenazihealth.edu. Those would be our financial counseling suite at the main hospital, our financial counseling suite at the new Grandy Health Center, and West 38th Street Health Center as well.
So you don't have to make a trek all the way down to the main campus on a weekday necessarily at noon, if you're working at noon, to get your financial counseling and marketplace instruction and help. You can go to any campus that offers that?
Yeah, so I would say our northernmost health center is the Picar Health Center.
Mm-hmm.
It's off of Michigan Road. And then west would be West 38th Street. And then our furthest east would be Grassy Creek Health Center, which is just past Post Road. So I would say we've got some north, south, east, and west. It just kind of depends on how far east, how far south. But yeah, we're located throughout the city, and anyone can assist with these specific types of applications.
Yeah.
And then we're offering some limited weekend hours at our financial counseling suite downtown.
So that's important to know. And there's a lot of flexibility there for people seeking help, and a lot of locations that are more convenient than just one. More convenient than just heading down to the main campus. So you're making it very convenient, very helpful. That is extremely helpful. And it's good for people to know that there are other options and other places that they may not have to travel as far to go and make an appointment to get help with navigating that marketplace, which can be daunting. Let us not forget. It can be daunting because how many different products are within the marketplace? I mean, there must be, I can't even imagine.
Yeah,
it's a lot. There are different, tiers, bronze, silver, and gold, and within those tiers, there are multiple plans. So,
and then you've got multiple multiple managed care entities that are offering them. So,
but a lot of convenience, though, a lot of convenience for those seeking help, and I love that. I love that part of it. And again, so the number to call to request a telehealth appointment, that number again is. Marcus or Vicky, can you give the number again?
Yes, 1-855-202-1053.
And Vicky, the website?
I would go to eskenazihealth.edu
to find a location near you. Okay. Well, did we forget anything? Because I don't want to leave anything out because this is important. We all need to have insurance if we can. So did we leave anything out, you think? Or is there anything else?
I think we covered it all.
Mm-hmm. Okay. Well, again, the number and the website, eskenazihealth.edu, and the number 1-855-202-1053. Those are the two keys right there. And let's get everybody going and shopping that marketplace because hey, it's important. And the important deadlines. Once again, can you go over those before we wrap up?
Yeah, so open enrollment officially ends on January 15th, 2025. If you want to ensure coverage at the beginning of the year, then you must enroll and make that initial payment by December 15th, 2024.
And very quickly, what's the biggest concern most people have as they approach this process? I know you all have been doing it for a minute or for a while. Is there one particular concern that you can kind of help put to rest for people that you get more often than not?
Yeah, I think the one for me is that it's too expensive. And that may be the case for some individuals, but I think the key is getting in and meeting with us so that we can give you the options for you.
That is key. Vicki?
I was going to say the same thing. I think the assumption is that it's going to be unaffordable. But I think it's because, not everybody understands that there's multiple tiers, like Marcus said, multiple plans, and then premium tax credits that individuals can qualify for to help ease that financial burden.
The big thing, I love hearing this whenever you go to do anything, we can work with you. And that sounds like that is the spirit that Eskenazi is offering as we inspire everyone to get out there and shop that marketplace with the help of Eskenazi Health. Thank you both so much for being with us and for all you do. And again, the website, eskenazihealth.edu, the number 855-202-1053. Vicki, Marcus, thank you both so much.
Thank you.
Thanks for having us.